cancer accounts for 28.2% of all female cancers in India. It's very important to be vocal about this disease, know the causes, methods, and markers for timely detection. Let's hear from Dr. Mala Srivastava, MBBS DNB Gynecologic Oncology, who comes with 38 plus years of experience. How do we identify breast cancer?
See, basically, cancer of the breast is known as breast cancer. The incidence is rising because we are living for a longer age group, because our life expectancy has become 75 plus, 80 plus, we are living longer. So once we are living longer, we are more prone to have cancers like breast cancer, endometrial cancer, ovarian cancer, and all other types of gynec cancers as well. So any lump in the breast should be taken with a suspicion, and you should go to your doctor, get yourself examined, get the investigations done, and prove that it is not breast cancer. You have to understand that having babies, 1 or 2 babies or 3 babies, and breastfeeding them, that's a protection against breast cancer. Nowadays, the incidence of breast cancer is rising because of a lifestyle. Not only we are living longer, we are having lesser number of children, and we are not breastfeeding them enough, so that our protection to the breast is not going enough. That is why the incidence of breast cancer is increasing in near future.
Ma'am, how do we self-examine if there is any lump in the breast?
Basically, if you have any patient of breast cancer in your family, then you also fall into the high-risk category for the breast cancer. So if you are falling into your first degree relative, that means your mother, your masi, or your sister who has breast cancer, then you are a high-risk category for the breast cancer yourself. So you should start doing breast self-examination starting from the age of 25. Immediately after your periods, you should examine your breast. Best time to do while you're taking bath, standing in front of the mirror and palpating your left breast with the right hand and right breast with your left hand. And you can see the size of the nipple, the level of the nipples or the areola, whether there is a change in the size, height, skin texture, or any other problem. And you can then palpate your breast and see each quadrant one by one, starting either clockwise or anti-clockwise. If you feel any lump, you should go to your doctor and get yourself examined.
So what are the markers?
These are genetic markers. If anyone in the family has breast cancer or ovarian cancer in the family or colorectal cancer in the family, then the person who had suffered from the cancer, their BRCA genes are done. If it is negative, then there is no need to do for the family members. But if it is positive, then in that case the family members are also tested for BRCA1 or BRCA2 genes. Because BRCA1, BRCA2 genes, they run into the families. There is known as hereditary breast and ovarian cancer syndrome or Lynch syndrome. So these things need genetic counseling, because everybody does not need all the genetic tests. But if you think that your first degree relative had BRCA1 positive and breast cancer, then you should go for a genetic counseling and get the appropriate test for yourself and your family members, so that the risk is stratified for your breast cancer, ovarian cancer, as well as colorectal cancer.
Thank you so much, ma'am, for sharing insights with us.